When a patient with severe burns gets rushed into the ER, the first, most urgent job is to pump them full of fluids to save their life. It's standard procedure. But what if that very life-saving act could trigger a second, completely silent attack? Today we're diving into a medical paradox, a life-threatening condition that can spring from the very treatment meant to heal.
Right, so think about it. The fire's out, the immediate danger should be over. So how on earth does the treatment itself create a brand new internal threat? We're going to get into this dangerous rise of pressure deep inside the body and see how it can turn a patient's recovery into an absolute fight for survival. So to really get what's happening here, we need to look inside the patient's body. It really all boils down to pressure and how a system that's usually stable can get pushed way, way past its breaking point. Okay, first, a super quick anatomy lesson. Inside your abdomen, there's a normal, steady pressure, kind of like the air inside a balloon. It keeps all your organs where they should be. This is called intra-abdominal pressure, or IAP for short. And when it's normal, everything just works. But this is where things start to get dicey. Doctors measure this pressure in millimeters of mercury, or mmHg. Now, in a critically ill patient, you want to see a reading around 5 to 7. But when that number starts creeping up and stays at 12 or higher, that's a huge red flag. It's a condition called intra-abdominal hypertension, and it's the first big warning sign. And if that pressure keeps climbing and it gets past 20 millimeters of mercury, you hit a catastrophic tipping point, abdominal compartment syndrome, or ACS. Now the pressure is so intense, it's literally crushing the organs, choking off their blood supply and causing them to fail. We're talking about a true crisis here. The mortality rate can be over 50%. This analogy is, well, it's perfect, and it's terrifying. Your abdomen is basically a closed box. When it fills up with too much fluid, that pressure has nowhere to go. So organs like your kidneys, your liver, your intestines, they just get squeezed. Their oxygen supply gets cut off, and the damage starts spreading fast. So what's causing this insane pressure spike in burn patients? This is where the story takes a really shocking turn. Because it's not the burn itself that's the direct cause. It's the treatment. And here's the paradox. A severe burn makes your blood vessels really leaky. So to stop the patient's blood pressure from crashing, doctors give them tons of IV fluids. It's the right call. But because those vessels are leaky, the fluid doesn't stay in them. It seeps out into the surrounding tissues and floods the abdominal cavity, causing this massive, dangerous swelling. You know, this phenomenon actually has a name. It's called fluid creep. It's what doctors call an iatrogenic complication, which is just a technical way of saying it's caused by the medical treatment itself. In that frantic rush to save a life, the body sometimes gets way more fluid than it can handle, and that's what kicks off this whole terrifying cycle. Okay, let's walk through this vicious cycle, because it's wild how one step feeds the next. It all starts with step 1, the life-saving fluids. But the burn makes the vessels leaky, that's step 2, so the fluid escapes. That leads to step 3, the abdomen swells, and the pressure shoots up. This rising pressure then squeezes the organs, step 4, cutting off their blood flow. And finally, you get to step 5. That lack of blood flow injures the organs even more, which makes the vessels even leakier, and the whole horrible cycle just keeps feeding itself. So the big question is, how much fluid is too much? Well, research has zeroed in on this number. The risk for abdominal compartment syndrome goes through the roof once a patient gets more than 275 milliliters of fluid for every kilogram of their body weight, all within the first 24 hours. To put that into perspective, for an average-sized adult, we could be talking about more than 20 liters of fluid. That is just a staggering amount for a body to absorb. And the numbers, they're pretty grim. Studies show that a staggering 82.6% of patients with severe burns will develop intra-abdominal hypertension. That's more than 8 out of every 10 patients. This isn't some rare side effect. It's a common and incredibly serious complication. Okay, so we've identified the enemy. But how do medical teams fight back against a threat that's being caused by their own treatment? Well, the answer lies in this incredibly delicate balancing act of watching, preventing, and knowing exactly when to step in. The best defense here isn't some fancy surgery, it's just being vigilant. The real key is to catch that rising pressure early and to practice what doctors call judicious use of fluids. This really just means giving the patient exactly enough to stay stable, but not a single drop more, so you never even start that dangerous fluid creep cycle. But when that pressure does start to climb, doctors aren't just guessing what to do. They have a very clear playbook developed by the World Society of the Abdominal Compartment Syndrome. It's a 5-point plan that covers everything from relieving pressure inside the gut to draining excess fluid, all designed to bring that internal pressure back down to a safe level. And they have a whole range of tools to do this, from the less invasive to, well, major surgery. They'll start with things like medications to relax the abdominal muscles, or maybe use a catheter to drain some of that extra fluid. But if the pressure just keeps rising and becomes critical, they have to pull out the big guns. That can mean surgically opening the patient's abdomen to give the organs room to breathe, or even cutting through the tough, burnt skin just to release that crushing pressure. You know, when you step back and look at the whole story of abdominal compartment syndrome, it's a really powerful lesson about one of the biggest challenges in all of modern medicine. The fact that sometimes our greatest strengths can also hide our greatest risks. So, what's the big takeaway here? It's that critical care is this unbelievable balancing act. The whole fluid creep situation is a perfect, if scary, example that even our best life-saving intentions have to be managed with incredible care. It really proves that sometimes less is more, and just constantly monitoring a patient, being vigilant, is every bit as important as the treatment itself. And all of this leaves us with a final, much bigger question, doesn't it? Our ability to intervene and save lives is more powerful than ever. But as we get better and better at it, we always have to ask, what other hidden dangers are lurking inside the very treatments we designed to save us?